Okay, you guys, how embarrassing was this? Let's see. Oh my gosh, I'm so sorry to everyone. He can't hear the microphone. Now let me put this in here. So sorry. Let me see if I can get this better now. Okay, can someone give me a comment about sound? Okay, thank you. I'm so sorry, everyone. I was working anyway. Now we've got the sound working. Okay. Hi, Trisha. Thanks for giving me a shout out on the sound. Okay, let me start my dialogue all over again because I was really in the zone. And so let me start and talking about this again. Okay. So what I was going to talk about tonight in the past podcasts, this is what we were talking about. We've talked about stomach problems. We've talked about arthritis, everything heart, autoimmune disorders. And as we were developing different things, I kept getting this question that was being asked on what would you do? So I get asked all the time, what would you do? Would you take this prescription? Would you do this medical procedure? Would you do this chemotherapy? Would you do this treatment for viruses or lungs, autoimmune conditions? And so I decided to develop a segment, you guys, on what I would do. And so this is the opportunity where I get to be really genuine and authentic and say, look, if I was diagnosed with a condition A, condition B, condition C, what would I do? Or what would I do if it was my wife? Or what would I do if it was my kids? And so what I'm going to do, this segment is all about what would I do? So what would I do section is what would I do if I was diagnosed with the coronavirus? And so not knowing that my microphone wasn't hooked up, I was talking about what had happened in 2014. So in 2014, there was this unique and novel virus that was associated with the Ebola virus. So it happened in Africa. I really like reading, virology books. I studied microbiology at Utah State. That's where I did my undergrad work. And I was so excited to read and learn about bugs, bacteria, and viruses and fungus and everything like that. So as I'm watching, then I read the hot zone and I'm looking at, the pandemic and these different movies. And sure enough, so this virus comes out in 2014. And I put together this presentation to share with patients 7 years ago. And as I was getting ready to give you guys this presentation, I'm like, oh my gosh, this is amazing. Like the same information about health in 2014 is important to know now. So when we look about this, at the statistics and the data that's coming out with the COVID virus and the coronavirus, the Covdi19 and the coronavirus and the Delta variant and these different mutations inside of the viral kingdom, one of the dialogues that I wish we talked more about was some of the things that we can do to help your immune system and your health. Because the data out there that's showing the escalating case rates and the infection rates, like you can take that data and if you just look at it slightly different wait a minute, there's millions of people that have been infected. And yes, there's been people really sick and died. And you can also take the same data and you can see that with that there's millions of people that have got better. There's millions of people that had either asymptomatic or they didn't have a lot of symptoms. And what's the difference between the people that had symptoms and the people that recovered? Well, it's their immune system. And so this is so important. I've been on a couple Fox radio shows earlier today, one earlier this morning, one we just finished up with, and they were saying, well, what should you be doing? Well, it's going back to the rules of health. In this presentation that I did for viral infections on Epstein Barr and rotavirus and herpes simplex 1 virus and the Ebola virus that was from a long time ago, there's some great data that's over there. And so if I got the diagnosis, here's some of the things that I would do. So I wanted to share you guys with that. Again, I'm a little bit embarrassed that I started off and had this wonderful 5-minute spiel and then there was no sound. Now we got the sound back together. And so let's jump into some information on this. So number one, here's the slides that I did in 2014 about what I would do if there was a viral pandemic, if Ebola crossed over the nation, across from Africa into the United States. This is some of the things that I was putting together back then. And it's something to remember, every day we have viruses that are coming in the office, and it's not just me. It's like every healthcare provider. The cold is happening. Shingles is happening. The Epstein Barr virus is in so many different people. I would say, I think it's like 100% of the population has been exposed to the cold sore virus and the Epstein Barr virus. And yet some people get cold sores all the time. And a lot of people, they don't get them. Well, what's the difference? Well, the difference is the cell mediated immunity. It's a part of the immune system that attacks cells that have been infected. So that's one of the things that is there a way to help modulate that or to help improve that from an integrative functional alternative medicine perspective? And then what can you do to get your immune system to turn on? So let's pretend like this. So here's the segment that I was going to do. If I woke up tomorrow and I had some of those COVID symptoms of, just feeling horrible, lung problems, congestion, fever, what would I do? Well, immediately what I would do is to make sure my fluid intake was as high as possible. I would, and not just any type of fluid. Like I'm going to be pushing chicken broth and water. I'm going to stay away from dairy products, which in my world, I think that those can be mucus generators. So I would want to stay away from it. I just want to get water. I would like to get some minerals and electrolytes. I'm not a super big fan of, the Powerade or Gatorade drinks or whatever, but I think it would be better than doing what my grandma liked to do, which is, if you're sick, you always get Sprite. Like Sprite was something that fixes every stomach problem. I don't believe that anymore. Matter of fact, there's so much sugar in 7-Up and Sprite that I think it's actually really bad for you. The other thing that I would do that most people, maybe they're not aware of, for the most part, fevers are really good for you. So when people are saying, hey, I was really sick, and then I took some over the counter, took a fever reducer, my response is, well, that kind of gives your infection another lease on life. Like we have to get a temperature up to activate the enzyme processes, and we have to get that temperature up in order to start the immune system. So when we take things that we may not need to, now granted, of course, there's such things as runaway fevers and the fevers being too high. Of course there is. But for the most part, for most people, having a temperature of 101, 102 in that range, like that's healthy for you. And so my discussion with my kids, and again, if this is pretending that I don't really want a fever reducer. I do want to get my fluids up. I want to get as much rest as possible. And then there's some really important things that we can do immediately to protect your mucous membranes. And so this is where I'm saying, look, if you're concerned about your immune system health, there's some customized supplements that I've done for people that are not exactly the dosages that I'm talking about because they're more synergistic, but just straight off the bat for a single supplement, like I would immediately start hammering the vitamin A, being about 10,000 international units of vitamin A. And vitamin A has some of the neatest properties available. It's so good for your immune system, but importantly, it's really, really important for lubricating your mucous membranes. So what's your mucous membranes? It's where basically air goes. It's where the saliva, it's your alimentary canal, it's your GI system. There's a lot of vitamin A in your eyes. And so if bacteria and viruses get in your eyes, there's so many immune system things that are supposed to happen to protect our eyes and protect our mucous membranes. I think those are incredibly important to get. I'm jumping on the vitamin A right away. The other thing that's all over the media, and I think it's so important to be aware of, is zinc. Like zinc it's such an important mineral for your immune system. And what no one hardly ever talks about is your thymus gland. So your thymus gland is this little gland that sits behind the subsural notch that literally helps the cell-mediated immunity. Now, when we talk about your immune system, there's two types. There's your humoral immunity, which is antibody and stuff basically outside of the cell. And then there's stuff inside of the cell, which is your cell-mediated immunity. And what's the most important gland to help your white blood cells differentiate or target viruses and cells that have been targeted by a virus is your thymus gland. So that's the gland right here. It's a little tiny gland. There's not a lot of medical prescriptions that affect the thymus gland. So hardly in medicine, they don't talk about it very much because there isn't a prescription pathway to treat it. Now, in the functional medicine space, one of the best things that I think that you can do for your immune system is to support that thymus gland. So they call that glandular therapy or proteomorphogen therapy. There's several different companies that have glandular thymus gland extract. And this is one of the statements that I hope that I can make still. And what I mean by that is this is my opinion. This is what I see in clinical practice, is that people that support their thymus gland do really, really well with chronic and acute viral infections. Now, I think one of the best ways to see what's happening with your immune system, I have some reservations about the PCR testing, which I think is a different discussion, because this is the what would I do discussion. So I'm saying, okay, I got diagnosed with COVID-19. What am I going to do? And one of the other things that I'd love to see on myself and for everyone listening is to do a complete blood cell count with auto differentiation. This is a commonly used test in the hospitals and the urgent cares and the medical clinics, the alternative medicine clinics, like almost everybody runs a complete blood cell count. And what is it testing for? It's testing for your white blood cells. And then the differentiation part, it's looking at your neutrophil count, which is your bacterial fighters, your lymphocyte count, which is your viral fighters, your monocyte count, which is your inflammatory indicators, your eosinophil count, which is your another inflammatory marker, and the basophil count. So there's 5 cells that make up your white blood cell count. So in someone that is facing an infection, a normal response, your white blood cell count should go up. So if someone's feeling sick and they have access to their blood test, like this is such an important diagnostic tool. It doesn't tell me if you have a herpes simplex 1 infection or an Epstein Barr infection or a coronavirus infection. A complete blood cell count will not tell you that. But what it will tell you is your body responding. So a normal white blood cell count ideally is 6,000 to 8,000, or it's measured in kilos. So it's 6 to 8 is the marker. If you have an infection, it should be elevated. It should be 10, 11, and 12. It means your body's responding. And then if it's a viral infection, your lymphocyte count should go up. So it's such a nice way to see, look, what is happening. If I take a complete blood cell count test and my neutrophil count up, which is a bacterial fighter, I have a bacterial infection. If your lymphocyte count is up, you have a viral infection. Now, it's very, very nonspecific. It doesn't tell me which virus it is, but it can tell me, is my body responding? So I'm working on vitamin C. I'm taking zinc, which I'm going to bring up the graph on zinc. I think this is so important for people to understand the power of zinc and what it does for people, because it really, really helps to get your immune system working and it gets it jump started. There's so many zinc deficiency people that it's depleted. And I think one of the this is just my personal opinion, I think excessive refined carbohydrates and I think excessive soda pop consumption is actually really, really difficult on your zinc levels, and no one's really talking about it. So when I pull up zinc and start telling everybody, okay, here's what it's for your immune balance, including the common cold. It's for respiratory tract infections. It's for wound healing. It's for digestive problems, including diarrhea, Crohn's disease. It's for metabolic syndrome, insulin resistant, which this is one of the frustrating dialogues that we're not seeing out there. No one's talking, or at least there's very little talk about how important it is for your immune system to not have excessive runaway sugar. Like, we know that sugar lowers your phagocytic index. Now, what that means is we have these white blood cells that are cruising around the body doing their thing. When they see a bad guy, they come around and they engulf that. So the terminology for it is a phagocytosis, which means it engulfs and it digests everything in that disease cell. Well, I think I got to remember if my timing's right. I'm almost certain it's an hour after ingesting 2 tablespoons of refined white sugar, your phagocytic index goes from 16 to 4. What does that mean? It means that a normal white blood cell has the ability to engulf or ingest 16 antigens or bad guys or infected cells before it turns into a pus cell and dies. And when you add refined white sugar, and in my opinion, high fructose corn syrup, what happens is now that cell, instead of being at 16, it lowers it to 4, which reduces our immune system response 4 times. And so when we look at the benefit of zinc, not only is it helping wound healing and it's helping respiratory tract infections. It's also helping insulin resistance and type 2 diabetes. It's good for mood disturbances, including depression, and it's helpful for thyroid balance. So what is depleted by zinc? It's the wrong food getting into the system. You supplement with zinc. So if I'm having the coronavirus, I'm doing vitamin A, 10,000 units right off the bat. Probably, not probably. For me, I would be doing it twice a day. And I would immediately jump on 50 milligrams of zinc. What is zinc good for? Again, insulin resistance, wound healing. Then the next thing that I'm doing is this amazing vitamin slash hormone slash metabolic precursor called cholecalciferol, or vitamin D. And what does vitamin D do? Well, it does everything. I mean, literally, it would probably be easier to write a book about what vitamin D doesn't do than what it does do. So just a quick rundown on vitamin D. Okay, bone health, cardiovascular health, decreases risk factors, increasing calcium absorption. It gives you immune system report. It also helps with insulin resistance. It's good for seasonal depression, multiple sclerosis, allergies, asthma, insulin and thyroid receptors, and it's good for metabolism. And when I'm seeing people in the office, I'm doing vitamin D tests all the time. The research that I'm aware of is that a good vitamin D level is somewhere between 70 and 100. Excuse me. And what do most people test coming out? I'm seeing most people in the high teens or the low 20s. And then we're seeing more and more data that's showing that vitamin D is so beneficial for upper respiratory tract infections. Now, I can't say that it absolutely is going to put the whack or the hit on the coronavirus. I'm just saying this is what I would do if I'm going to be taking really high dose. So one of my really good doctor friends that I have enormous respect and admiration for is like, hey, Jason, if this is what I'm seeing with patients, when I can get them somewhere between 50 and 150,000 units of vitamin D levels for 6 to 8 days with the coronavirus, it's absolutely just turning people around just like that. So I mean, this program is not meant to substitute for a doctor-patient relationship, but I'm immediately jumping on high vitamin D levels. This is what I would do if I was diagnosed with the Delta variant, the virus. And by the way, just not like any acute virus, this is what I'm doing. Vitamin A, 10,000 units, zinc, 50 milligrams a day, and then tons and tons of vitamin D. It's my next go-to. It's my favorite vitamin, which is vitamin C, which there's a couple things that no one talk about when it comes to vitamin C, because you can be taking tons of vitamin C and it not working well if you don't have the cofactor. And so about a year ago, I did a presentation on what is the most important vitamin. And I would argue that it's rutin factor or vitamin P. So vitamin P is the old school terminology for rutin factor and quercetin. It's basically kind of a subset of bioflavonoids. And you know why it's so important? It's because it makes vitamin C work. So vitamin C is my favorite vitamin. And if I had to do a summary on what vitamin C does, it donates electrons to the body. And what are electrons? It literally donates energy. So it helps with the immune system. It's an antioxidant. In my experience, I think it's really good for the prevention of diseases and mortality. It's good for wound healing and helpful for neurodegenerative problems. You know, one of the things that I'm recommending for people that have Parkinson's and Alzheimer's is like, let's get your energy levels up. It was discovered by, Albert, am I saying it right? Grigori in 1928. It was by Dr. James Lind, was a famous English physician that basically determined that scurvy is what was happening with English sailors when they got on ships and would eat pork and salt tack, this hard bread and meat, and they weren't getting any vitamins. And what was happening? They were having circulation problems, infectious disease, their teeth were falling out, their joints weren't working. Well, man, that kind of sounds like fibromyalgia, right? So this is one of the things that you do for fibromyalgia is let's get a whole bunch of electrons inside of the body. So the vitamin C pathways, I think, are so important. And people say, well, how much you should take? Well, the book that I love to follow inside the office, Curing the Incurable by Dr. Tom Levy, who is a board certified cardiologist in internal medicine, says, look, go to bowel tolerance. So, bowel tolerance means you take the vitamin C until you start getting loose bowels. Now, there's different types of vitamin C. I've found that ascorbic acid powder is less tolerated than something called liposomal vitamin C. So liposomal vitamin C is when you take a fat like sunflower or soybean lecithin, a natural soybean, and you mix vitamin C powder with it, and basically it's a goop. And I see that to be extremely well tolerated. And so if I am diagnosed with COVID-19, like I'm literally getting liposomal vitamin C and I'm drinking as much as I can. So, I mean, it's a goop, it's a liquid. And the reason why I would do that is because I have seen really, really good outcomes with high dose oral vitamin C outcomes. As much as you could take the bowel tolerance. Now, I've had people literally be taking 30 and 40,000 milligrams. So the RDA levels are 500. I've seen people taking 30 to 40,000 milligrams of liposomal vitamin C without any stomach problems. And for me, I take about 5,000 liposomal vitamin C just to be healthy and to stay prevention. Now, I haven't had really any sicknesses or illnesses in recent memory other than a dirt bike crash, another dirt bike crash, a dirt bike crash before that. And I think, anyway, you're picking up on a theme here. Like, I like to ride dirt bikes. I think I'm a lot better in my head. And so I try to ride with my sons, and I have some wipe. That's the only way that I get really fallen off kilter. But vitamin C is so healthy and so good for your immune system. So if I'm diagnosed with the COVID-19, this is what I'm doing: vitamin A, zinc, vitamin C, and vitamin D. That's a really good baseline of what to do. And the next thing that I would do if I have access, I am doing some high dose vitamin C infusions. Again, this is going back to Dr. Klenner's work. This is supported by Dr. Levy's work with 1,200 studies. I would argue that vitamin C may be the most studied, quote, drug available. And I like skipping the stomach. I like to do vitamin C infusions. I think that there's a really good place for that. There's a really good article, or actually a YouTube special in Australia called The Vitamin C Miracle. It was about a guy a couple years ago that was given up for dead about swine flu. And he was in the intensive care, and the hospital system was going to take him off of life support. The family convinced him to go through a IV vitamin C regimen. It's a really fascinating story. And yep, it's totally anecdotal. I mean, I can hear people right now saying, well, there's no studies on it. Well, there's tons of studies of what vitamin C does for infectious disease. Is there any studies on infectious disease and absolutely having an effect on the COVID-19? Well, I think there's some empirical studies, there's some case studies, but I see this do really well for infections every day over the last 20 years. Now, my friend Terry asked me, is there a brand that you recommend for vitamin C? Well, I like a brand called POTC, the liposomal C. And then there's another question that says, if you have acid reflux and diverticulitis, is vitamin C good? I would say that when you have the liposomal vitamin C, which is the vitamin C protected by a fat, I see like such a good tolerance for that. Even when people have acid reflux, irritable bowel disease, malabsorption disease, ulcerative colitis, and Crohn's disease, like your body is desperate for energy. It's desperate for vitamins that make it work. Now, there's some things that you can do that will accidentally aggravate those as far as like a dietary perspective and some other things, but I haven't seen it with vitamin C. So I'll post inside of the comments what I would do for vitamin C, what I would do for zinc, what I would do for vitamin A and vitamin D. But this is what I'm doing. And I didn't want to make this a like, hey, I'm going to go promote a different brand or I'm going to sell a bunch of stuff. It's not about that. Like the program design was this segment. So it's what I would do if I was diagnosed with COVID, what I would do if I was diagnosed with Epstein Barr, what I would feel good, what would I would do if I was diagnosed with the COVID or ulcerative colitis. Like that's the segments that we're doing from here on. Because I think the most important question that you could ask your doctor is when they recommend a treatment program. Like I tell people all the time, you should look the doctor in the eye and you should say, is this what you would do if I was your wife or I was your daughter or your son or your brother or your dad? Like, what would you do? And so many times you get a different answer. I think it's one of the most important questions to ask people. Like if your healthcare provider is asking recommendations, like, is this the recommendation that you would do? Because it's so fascinating, because many times they're like, I would do that. I have had a couple doctors that literally they've called me after, hey, will you treat me after hours? Because I don't really like, I'm recommending different treatments. And and what I'm going to do is different than what I'm recommending to patients. You need to ask that. Like, this is the most important thing with your doctor-patient relationship, is like, you go in for health, you go in to be taught. Like, docere means Latin for teacher. So you go into your teacher and you're saying, look, I've got XYZ disease. And he should come back to you with, hey, here's some recommendations or suggestions for that. For XYZ disease, we should do ABC treatment. And then I'll encourage people, you'd ask them, you can ask this to me. Like, if you had that diagnosis, is that what you would do? I love that question. And I think we should be asking more of it. So what would I do with that? Now, on top of this, if I was diagnosed with the Delta variant, what would I personally do is I went through the program of vitamin C, vitamin A, vitamin D, and zinc. That's my baseline. I also really like other herbal immune system stimulating things. Like, I like Thymus Gland extract. It's really good for your Thymus gland to get it to turn on so that your body can engulf bad and infected cells. The Thymus gland is so important. There's an acupuncture way to stimulate it. There's another German therapy way to stimulate it called neural therapy, where you can like do these little type of B vitamin injections over the Thymus gland. It's not very well known in America. It's so powerful. Neural therapy over the Thymus gland, I think, is something that I would absolutely consider. I would do IV vitamin C if I had the opportunity. The vitamin C proof, that's the 2020 segment that you did with the guy in swine flu in Australia. I think it's wonderful to watch and get some information about what it can do for you. Any medical option that's available, if I have this and I'm downtrending and I'm going in the wrong direction, like I would absolutely be trying to get a hold of ivermectin. And I don't prescribe ivermectin, or I don't prescribe hydroxychloroquine, and my license doesn't allow it. But what I've been able to understand from other health providers and patients that I've seen them recover, like, I think there's some really good things that you should be aware of over there. Okay. And okay, the other things, I was just starting to go down the herbal pathway. Vitamin C, vitamin A, vitamin D3, zinc. I'm sorry to beat a drum. I just think it's so important to do that. The other ones that I really like, I like the echinacea. I like lomatium, which is a Native American herb that it's so good for your immune system. Lomatium is so underrated and hardly anybody knows about it. I really like elderberry. And you know, a year ago they were talking about the cytokine storm. I don't believe that at all. This is just my clinical opinion. I think elderberry has some really nice antiviral components. Ashwagandha, andrographics. I mean, there's so many, like, this is just the surface. Yellow dot, burdock root, shiitake, maitashi, cordyceps mushrooms. Like, I would be like, okay, do I have access to those? And because if you get your immune system healthy, like, I believe that is the most important thing that we're taking away from this situation, where is your immune system healthy, and what can you do? And then the risk factors, like, it's important to move. It pumps out your lymphatic system. Remember, your white blood cells arrest the bad guys. They take them to the jails of the body. What are the jails of the body called? They're called your lymphatic system. So what makes your lymphatic system drain? Skeletal muscle movement. So, you know, walking and movement. And of course, if you're too sick to get inside of a movement pattern, like, the minute you can move. And people say, well, I don't know if I really want to go to the gym. No, I'm not talking about going to a gym. I'm talking about, like, trying to get some exercise, parking your car a little bit farther away, getting out in the sunshine, getting a vitamin, getting when sunlight hits your skin and you have essential fatty acids in your skin, the ultraviolet turns your skin into cholecalciferol, which is vitamin D. That's why I think getting out and aside is so healthy, which, by the way, our office was started in 1916. My great-grandfather developed a sterling reputation for helping people with the worldwide flu of 1918 by doing vitamin A, vitamin D, and using that Native American herb called lomatium. Okay, so that's a kind of a overview of what I would do. I've got a couple comments here that says, please remember to post the comments of the brands and dosages you recommend. I will do that. the reason why I decided to do it in this manner, I just wanted to give people information that there's some really good things out there. There's some really good things to help your immune system reduce your sugar intake. I think that's so important, to take away the food source or of bacteria. Now I understand this is a viral infection, but the other thing is that high sugar levels reduce your phagocytic index, and then you can't get rid of chronic infections. This is one of the secrets to helping people's immune systems to turn on, is let's take away things that are like, it's like trying to go fast in your car with your foot on the brake. Like the sugar is the foot on the brake. You can't get your car to go normal speeds if you have a refined sugar in your system. So you guys, that's a real quick overview. I'm so excited to do these segments. We are doing this whole segment of what I would do. And this is our first segment. We're doing a complete rework or overview of all of our platforms. And it's going to be so fun. I didn't want to miss this one because I've had so many questions about, well, what would you do if you had the infection? Well, that I just told you. So I'll post the comments, the dosages, the brands and stuff, where to get this. And Linda Webster just said, what's the Native American herb? Spell it out, please. Linda, it's LOMATIUM. Okay. So that's what it is. Lomatium. Now the full name is Lomatium dissectum. I'll post where the company, where I get it from. And I just think it's amazing. I've had such a good response with mononucleosis, with shingles, with herpes simplex ones, with the lomatium. And so that's where I wanted to tell, like, just pure information inside of the segment. I've got this on a couple different Facebook channels and my YouTube channel. So I've got some work to do to go over and tell people, where you would like to get it. A big shout out to all the comments and likes. And if there was value to the video, you guys, please like it and share it. Remember, we're here every Wednesday night at 6 o'clock. Next week, I'm going to be talking about what I would do if I had skin cancer. I promised a patient that I would do that said, hey, I've just got diagnosed with skin cancer. What would you do? That was part of the reason why we decided to develop this segment. So that's going to be our show next week. Tomorrow, we have inside of the studio, well, kind of inside the studio, we pre-recorded a segment on a viral condition. You're going to meet a patient named Connie, and I'm going to go into extensive detail on what we're going to do with Connie tomorrow. Now at 5:30, that's when we're going to do our segment live with Dr. J. At 5:30, we're going to actually take you inside the trenches and show you the application of everything that I told you. I had a patient that was given up for dead. They came to the office, literally carried in on a stretcher. I took a look at it. I'm like, please don't die inside of the office. This was pre-coronavirus, but biology is biology. And we were able to give her the vitamin A, the vitamin C, the zinc, the lomatium, the lymphatic drainer, which is potassium and hydrochloric acid. She made this amazing recovery. She's going to tell her story tomorrow. Remember, inside of our Thrivers program, we have a special membership program that we do every night at 7 o'clock that we go to right after this. And I want to invite people. That's where we go a little bit more in depth. It's part of our inside the office program that I invite people. If you want more information about that, it's thewestclinic.com. I'll post that inside of our program as well. Every week, if you're inside of that program, you get a virtual office visit with me where you can ask questions. And I go into all the details. I design treatment programs and everything else for everybody. That's what we're doing at 7 o'clock. Don't forget our show tomorrow night at 5:30 on chronic viral infections. I'm Dr. West. I'll see you guys next week on what to do if I got diagnosed with skin cancer. That's our show for tonight. We'll see you guys later.